Hey guys, and welcome back to UWorld Nursing Next Gen NCLEX Review. My name is Nicole. I'm a nurse here at UWorld. Happy holidays. I know it's the right before we get to the holiday week next week, so I hope y'all are tuning in. Make sure to share and subscribe. Today we're going to be doing a question drill. Today's topic is prioritization and delegation. So we'll do a couple prioritization questions and then a couple delegation questions as well, just back to back. But then also, since it is the holiday season and a gifting season, we are going to be doing a gifting to 3 lucky one of y'all of a UWorld subscription. So stay tuned, and we will be announcing that at the end of our session. All you have to do is go to uworldnursing.com and fill out our event subscription page. Even if you are already subscribed, just go ahead and do it again so we can get a new count for today. And 3 of you guys will be gifted a UWorld subscription. Perfect time for the holidays. So let's get started. Oh, and also make sure you share and follow. That is a part of the giveaway entry. Make sure to share, follow, and fill out the information on UWorld Nursing. Okay, let's get to our first question. The nurse is caring for assigned clients. The nurse should first assess the client who, option 1, has pneumonia and a temperature of 99.9 degrees Fahrenheit or 37.7 degrees Celsius. Option 2, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. Option 3 has ulcerative colitis and severe abdominal cramping. And option 4 has a history of a stroke and is unable to lift the arm on the affected side. Let us know what you guys think in the chats. Like always, we like to have a community here in the chat. So we have Nurse Samantha here moderating and Nurse Jackie. So they will be giving all the feedback if I go a little bit too fast and you'll want some clarification and just talking in the chat. So go ahead and let us know what you guys think. And we'll be good to go. Okay, I'll give you about 5 more seconds. 5, 4, 3, 2, 1. The answer for this one is option 2, has cellulitis of the right lower leg and a heart rate of 130 beats per minute. So we are wanting to know what we should assess first, as in what is our priority. When we're thinking of assessing clients and thinking of priority, we're thinking of our ABCs, airway, breathing, and circulation, or anything that can affect any one of those, airway, breathing, or circulation. So option 2 has cellulitis of the right lower leg and a heart rate of 130 beats per minute. This is showing characteristics of sepsis. So sepsis is a life-threatening reaction to an infection that is an exacerbated of reaction. So instead of like fighting the infection, it actually becomes more inflamed. So with this one, we have a positive infection, the cellulitis of the right lower leg, and then 130 beats per minute, which is outside of the normal heart rate. That is showing that we are going into a downhill spiral. We always want to catch this quickly to prevent it from causing tissue damage or organ failure. So this would be our highest priority to treat. Give them antibiotics, give them IV fluids to prevent anything from getting worse. Option 1 has pneumonia and a temperature of 99.9 degrees Fahrenheit. This is an expected finding. It is an infection. They are probably going to have a temperature, but 99.9 is not going to be something that is higher priority than someone that is septic. Option 3, abdominal cramping, is another expected finding of a ulcerative colitis. So again, not a priority at this moment. And then has a history of a stroke and unable to lift the arm on the affected side. Again, an expected finding with someone who has had a stroke. So you guys did great on that one. Question 2, the nurse is caring for assigned clients. The nurse should first assess the client who, option 1, has a femur fracture and altered mental status. Option 2, has a hip fracture and a discrepancy in hip and leg length. Option 3 has osteomyelitis and reports pain rated on as a 9 on a scale of 0 to 10. Jesus. And then option 4 has a lower leg amputation and reports paresthesia in the amputated foot. Let us know what you guys think in the chat. And if you're just joining in, welcome, welcome in. We're doing another question drill. And we are also going to be gifting 3 lucky students a subscription to UWorld Nursing. All you have to do is go to uworldnursing.com, fill out all that information on the page, and also follow us on social media, and that will be an entry into our giveaway or into our gifting, and then I will announce the winners at the end of the session today. So let us know also in the chat when you've done it. So like say done, 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 you got it. Let's get some people in there and let us know who's entering. Lots of good answers as well. Good job, guys. Love to see it. Perfect. Yay, good answers. Okay, correct answer for this one is option 1, has a femur fracture and altered mental status. So first, again, we're thinking of what is the most important thing to do and the priority. Also, we're looking for things that are expected versus complications. So if these are expected findings, then that's not usually going to be our correct answer. We're going to look for complications. So option 1 is a complication, has a femur fractured and altered mental status. If a client recently went through surgery, this is showing signs of what we call a fat embolism. So that is when globules of fat leave the bone and actually travel in the bloodstream. And this can clot off the lungs, the skin, the brain, the heart, which could all lead to complications and an emergency. So altered mental status is showing that it's blocked vessels in the brain, which can also lead to more problems and complications. So we want to assess that client first. A client that has a hip fracture and a discrepancy in leg length, that is an expected finding. If your hips are unaligned and fractured, your leg might be longer in one leg than the other. And then option 3, osteomyelitis, reports pain of 9 on a scale of 0 to 10. Again, an expected finding. It is important to assess pain since that pain is really high, but it's not going to be high of a priority as then option 1. And then option 4 had a lower leg amputation and reports paresthesia in the amputated foot. Again, an expected finding. This is what we call phantom limb pain, and unfortunately, it's expected. We'll assess that after we assess the client in option number 1. But you guys did great. Let's move on to the next question. The nurse is caring for a client who is experiencing thyroid storm. It would be a priority for the nurse to, option 1, initiate beta blocker therapy. Option 2, administer radioactive iodine. Option 3, maintain the client on NPO status. And option 4, place a warming blanket on the client. Let us know what you guys think in the chat. And nice to see that a lot of people are getting it done, done, done in the chat. Good job, guys. Also, let us know if you have recently passed the NCLEX or just scheduled your NCLEX during this holiday season. We would love to wish you the best of luck or congratulations. And let us know what's going on with you guys. And your correct answers, lots of correct answers. And lots of dones. Good job, guys. Done, done, done. Perfect. We're going to move on to the correct answer. Option 1, initiate beta blocker therapy. So again, priority, thinking of the most important ABCs, airway, breathing, circulation. So what is a thyroid storm? A thyroid storm is a complication of hyperthyroidism. It occurs when the thyroid gland releases a large amount of thyroid hormone, and that kind of revs up our metabolism, and we become a super hyper metabolic state. So think of tachycardic, you have high blood pressure, you have cardiac dysrhythmias with high and fast heart rates. So we want to do things that will help bring this down. to get them out of the thyroid storm, which would be initiating beta blockers. This will kind of slow everything down. Option 2 is a treatment also for hyperthyroidism, but we want to treat the acute situation, which could be a high heart rate, a high blood pressure, quicker than the longer term therapy, which would be the radioactive iodine. Option 3, maintain the client on NPO status. That's not really appropriate in this situation. We want to fix the thyroid storm problem. And then option 4, placing a warm blanket on the client. That would actually increase it all over again. Think of a fever, you're hot, you're having a high hypermetabolic state. We want to actually cool them down. So we want to put a cooling blanket or put ice packs in their arm, in the groin and armpit. So that would actually be the opposite. So option 1 is the correct answer for that one. And you guys did pretty good. Next question. The nurse is assessing a client who has a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, serous drainage in the collection chamber. Option 2, crepitus around the insertion site. Option 3, intermittent bubbling in the water seal chamber. And option 4, clamp drainage tubing. Let us know what you guys think in the chat. And then also, do y'all have any fun holiday traditions? Starting next week is the holiday time. If you celebrate, put it in the chat what you celebrate, or any fun holiday traditions that you are looking forward to now that school is over. Maybe for some of y'all, it's just sleeping in. That would be me. I just like sleeping. And let us know also what you guys think of the answer for this question. Lots of good answers. Doing great, everyone. Good job. Good job. Perfect. Okay, correct answer for this one is option 4, clamp drainage tubing. Again, priority. We're going to think what's most important. Think ABCs. Options 1, 2, and 3 are usually expected findings with a chest tube. We are going to see some drainage in the collection chamber as it's draining that pleural cavity as it re-expands the lung. Crepitus around the insertion site, we are definitely going to be feeling some crepitus. We would be concerned if it starts spreading up or into the upper chest and down to the arm, but around the insertion site could be an expected finding. We just want to make sure it doesn't get any bigger. And then intermittent bubbling in the water seal chamber, again, an expected finding. We will see it with breathing sometimes. A clamped drainage tubing, we never want to clamp. It will increase the negative pressure, and also it affects what the whole purpose of a chest tube drainage is doing. So if you clamp it, you're not going to have that drainage. You're not going to be getting that air. You're not going to be re-expanding the lungs. So we always want to follow up on why the chest tube is clamped and get it unclamped. But you guys did great on that. Let's go to, so next we're going to be getting into delegation type questions. So take a look at this chart, kind of memorize and understand what is the scope of practice of each one, the RN, the LPN or LVN, and the UAP. And the next couple questions, we will be going over certain delegations. What would be the right way or the right person to delegate certain tasks to. And again, if you are just joining in, we're going to be gifting 3 lucky students a UWorld subscription. All you have to do to enter is follow us on social media and then go to uworldnursing.com and fill out our event subscription page. Go in the chat, click done, and we will pick 3 of you lucky winners to get a UWorld subscription for this holiday season. So let us know when you get that done, and we'll go to the next question. There we go. Question 5. The nurse and licensed practical nurse are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the LPN? Select all that apply. Option 1, create a plan of care for a client with chronic stable angina. Option 2, measure a client with heart failure for anti-embolism stockings. Option 3, select discharge teaching topics for a client with arterial fibrillation. Option 4, administer enoxaparin to a client who is receiving skeletal traction. And option 5, apply a sequential compression device for a client with limited mobility. Remember, select all the apply, so more than one right answer. And 3 lucky winners will get a giveaway. Good job, guys. Oh, I'm seeing some fun holiday traditions, going away with family members, gingerbread house making, caroling. I haven't seen a caroler in a long, long time. You can come carol to me. What are y'all's favorite Christmas or holiday songs that you like to sing? I haven't heard caroling in a very long time. And good answers, guys. Good job. Perfect. The correct answers for this one is options 2, 4, and 5. So we're thinking of the things that a licensed practicing nurse or LPN can be done, or that can be doing, which is measuring a client with heart failure for anti-embolism stockings. This is a generic just measurement. It's not measuring any complications, so it's okay for the LPN to be doing. Administer enoxaparin to a client who's receiving skeletal traction. This again is appropriate. LPNs can administer medications. They just can't give IV push medications, but a sub-Q injection like enoxaparin is okay for an LPN to be doing. And then option 5, apply a sequential compression device for a client with limited mobility. Again, it's appropriate, it's non-invasive, so it's very safe for them to be doing. Options 1 and options 3 are left for the RN to be doing. RNs are left to initiate plan of cares and also doing discharge. So beginning and end, think of that as what the RN can do, initiate the care plan and discontinue the care plan or do discharge teaching. And then the LPN can do everything in the middle, which is reinforcing the care plan and any teaching. So good job, guys. Next question. The nurse and unlicensed assistive personnel, UAP, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the UAP? Option 1, assist a client to the bathroom for the first time following surgery. Option 2, feed a client with dementia who has serum glucose level of 70. Option 3, explain why incentive spirometer use is important to a client with postoperative pneumonia. And option 4, take vital signs every 15 minutes on a client who was just transferred from the post-anesthesia recovery unit. Let me know what you guys think in the chat. Which one do you think is appropriate for the UAP now? Let us know, let us know. You guys are doing great with these questions, and I'm seeing a lot of dones as well. I want to see, did anyone leave any songs in here? I'm a childish person, and I like Jingle Bells. Or could I like Jingle Bells Rock? Jingle bell, jingle bell. No, I won't do that to you guys. Good caroling. Caroling music in there. Thanks, guys. Perfect. Okay. Correct answer for this one is option 2. Feed a client with dementia who has a serum glucose level. So a UAP has usually the most restrictive scope of practice that they are allowed to do because we don't want them to do anything invasive. We don't want them to be the first or the last person to have the eyes on the client. So feeding a client with dementia who has a serum glucose of 70 seems the most stable and the most appropriate. Feeding them by mouth, although their blood sugar is on the lower to normal side, we don't have any indication that anything else with them is abnormal. So feeding a client would be the most appropriate. Option 1, assisting the client to the bathroom for the first time following a surgery. Again, with a first time endeavor, whether it's education or walking or seeing outcomes, we want the RN to be doing that. So that would be appropriate for the RN to do. Option 3, explain why incentive spirometer use is important to a client. Again, that is something that we want the RN to be doing, RN to educate, or the LPN, if the RN has already educated them, the LPN can re-educate them on why incentive spirometer use is important. And then option 4, take vital signs every 15 minutes. This seems like a patient who is unstable, so we want them to wait a while and have the RN take the 15-minute vital signs on the client instead, so they can be aware of any complications and new things that might be coming up after they come out of the PACU. So that would not be appropriate for the UAP, but you guys did great on that one. Next question. The nurse in the intensive care unit is caring for a client who is mechanically ventilated with a tracheostomy tube. Which of the following activities would be appropriate for the nurse to assign to the unlicensed assisted personnel, the UAP? Select all that apply. So again, more than one right answer. Option 1, apply moisturizing solution to the oral mucosa and lips. Option 2, clean the area around the tracheostomy stoma with normal saline. Option 3, educate the family to maintain the head of the bed at least 30 degrees. Option 4, obtain and document respiratory rate and, pulse oximeter, I can't say that word, pulse ox readings. Option 5, perform passive and active range of motion exercise. Let me know what you guys think, and make sure you keep entering in. If you are just tuning in and just straggling in, we are doing a holiday giveaway, a holiday gifting, I should say, and gifting 3 of you people a 30-day subscription to UWorld Nursing. All you have to do is go to uworldnursing.com, fill out the events page, little information that is on there, and then also follow us on social media. Come back in our chat and say done, and we will select 3 people at the end of this session to give away the subscription. So let me know what you guys think when y'all are done, what the answers are. And I did see, if you are already following us and you're already subscribed to our channel, and on the events page, you can do it again, and it will be a new entry for today. So if you did it yesterday and you came back again today, you can do it all over again today, and you'll be a new entry. So let's do... The correct answer for this one is options 1, 4, and 5. The UAP, again, has pretty much the most restrictive scope of practice. So applying moisturizing solution to the oral mucosa lips. This is okay. It's non-invasive. You're just moisturizing and keeping them clean and happy. We think of like routine daily care, all the things like eating, bathing, cleaning, moisturization. Those are things that the UAP can do. Option 4, obtaining and documenting respiratory rate and pulse ox readings. Again, this is okay if the client is stable. So this is just your routine vital signs in this case. And option 5, perform passive and active range of motions. Exercises, that's again turning in the bed, shifting in the bed, or getting from the bed to the chair. These are good exercises on a stable patient, so that is okay for the UAP. Option 2 would be incorrect. We want to leave that to the nurse or maybe even a respiratory therapist, just in case there's any breakdown or complications around the tracheostomy. We want to leave that to the professionals that can train, and just to make sure that it doesn't come unhooked from any ventilation circuits. Option 3, educate the family to maintain the head of the bed. Again, education is usually initiated by the RN, so we want to leave that to the RN. But good job, guys. Question 7, the nurse and unlicensed UAP, unlicensed assisted personnel, are caring for assigned clients. Which of the following activities would be appropriate for the nurse to assign to the UAP? Option 1, assisted 2-day post-operative hip arthroplasty client with morning care. Option 2, collect a urine specimen for culture and sensitivity from a client with a Foley catheter. Option 3, irrigate colostomy of a 2-day post-operative colostomy client who is stable. And option 4, refill the empty internal feeding container with tube feedings. Which would the nurse assign to the UAP? Let us know. Let us know in the chat. Also letting you guys know, next week we are taking a little holiday break, but we will be back the following week with some content. And next year we have a full list of things that we have planned and ready to help you guys prepare for the NCLEX. But if there's a certain topic that you would love for us to go over, whether it's in lectures or whether it's in question drills, let us also know in the chat and we'll see if we can put that into our schedule to help you guys in the best way possible. Lots of good answers in the chat. Good job, guys. Good job, good job. Perfect. Okay, last answer. The answer for this one is option 1, assist a 2-day post-operative hip arthroplasty client with morning care. This is something that, again, we want to give to the UAP. We want to give them all the things of routine daily care. So getting up to go to the bathroom on a stable patient, eating, drinking, and then morning care. So this would be our correct answer for this one. Option 2, collect a urine specimen for culture and sensitivity through a Foley catheter. That is our keyword there. We actually want to leave this to the RN. This is considered a sterile procedure to collect a culture and sensitivity through a Foley catheter. If it was like a clean catch, from a client just like going to the bathroom, that is something that they would be able to do. Irrigate colostomy of a 2-day post-operative colostomy client. We don't want to have them do anything invasive, so this is why option 3 would be incorrect. We don't want them to be irrigating anything. And then option 4, refill the empty enteral feeding container with tube feedings. We don't want them to be initiating and giving any feedings through a feeding tube, so that would be, again, up to the RN. But you guys did great on that one. Like always, thank you guys so much for tuning in. And we have our lucky winners for today. Can I get a drum roll, please? Or a little jingle? Winner number 1 is Miss Maria. I am going to butcher some of these names, and I am so sorry because that is my life story, everyone butchering my name. But Miss Maria Panadira. And then we have Miss Nikisha Dickerson for winner number 2. And winner number 3 is Mr. Donovan Thomas. Congratulations to you guys. We will be in contact with for y'all subscriptions. I hope you guys have a great holiday rest of the break and season. If you want to share and follow us, that would be the greatest thing of all time. We are so close to hitting our subscriptions on TikTok, so make sure you follow and like us on our story. And I hope you have a wonderful and amazing Christmas holiday and holiday break.